Hey, Mike here. I do a lot of research online and I'm always looking for trends and trying to figure out what people are thinking about. And I came across something the other day about people actually disenrolling from Medicare plans. I hope they're enrolling in something else because having just the Medicare card alone can be a little expensive. And I started to realize there's a lot of misunderstandings about those plans. And I came up with a short list of why I think people are possibly disenrolling. Let's talk about the first one right here, okay? Doctors not in network. Well, if you're first looking at the plan, obviously it pays to do a little research on it and see if your doctor actually takes the plan that you're considering. Most of the time, people will get into plans and they haven't checked that, or what can happen is your doctor may stop accepting the plan for whatever reason. So it's always a good idea to check, and also, even though the doctor may show up in network, it's always a good idea to call the doctor to make sure they actually do take it. Next one here, meds not covered. Well, again, if you're first considering a plan, it's really important to make sure that all of your medications are covered. Of course, there's no idea, you're never going to know what med you're going to get on, and you can only hope that your plan will cover it if there is some strange med that your doctor prescribes for you. But most of the time, a lot of the generic meds and the blood pressure things, they're all going to be covered. The other thing is, what I don't think a lot of people realize is that if you're on a plan and you do get a med that's not covered, your doctor can apply for a formulary exception, in which case the plan will cover it. Other one, need referrals. Well, if you're on a plan that needs referrals, that's kind of a dinosaur. Most plans have gotten away from that. Of course, if you're on an HMO, some of those plans do require referrals. The easiest way to fix that is to get yourself onto a PPO plan, which stands for Preferred Provider Organization, in which case you don't need referrals. You can go in and out of network with those plans, so a referral and choosing a primary care physician is not necessary. Here's one that I see sometimes. Service approvals. What does that mean? Well, I need an MRI. It's got to be approved before they'll pay for it. Any one of a number of other things that there has to be an approval before your plan will actually cover it. It shouldn't take any more than 3 or 4 days. I've heard of some people actually not getting an approval for whatever reason, but there's usually a reason for that. For example, if you've gotten approval for one MRI, they're not going to approve you for a second one for the same thing if the first one wasn't done. So it bears looking into why something hasn't been approved. Your agent or broker should be able to help you with that. Unexpected billing. Well, Medicare Advantage plans have a copay for every single thing that you do. I've had people tell me, oh, this is good, I don't have to pay for anything. No, you do have to pay for something. Medicare Advantage plans are zero premium plans for the most part, including the prescription drug plan, but they have copays for everything. So you have to be prepared to pay a copay when you use it. And the first thing you should do is check with your evidence of coverage. You can get ideas out of the summary of benefits. Check with your broker. He can look up the plan for you and tell you what it's going to be. So these are just some of the things that I've come up with. Maybe there's some other things going on with them. The other alternative is to go back to your Medicare card, which is an A and B coverage, Part A and Part B, but there's a lot of cost sharing with that. The other is to go with a Medigap plan supplement, which of course Medicare is primary and that's secondary. Okay, hope it was informative. Comments are welcome. Take care.